Hello, and welcome to myTRIAList. Today, we will provide an overview of the HARMONY Peri-Operative Lung clinical trial. This study aims to determine whether the addition of 2 drugs to chemotherapy works better than the addition of 1 drug to chemotherapy in patients with newly diagnosed non-small cell lung cancer who can be treated with surgery.
What is non-small cell lung cancer?
Non-small cell lung cancer, or NSCLC, which makes up about 85% of all lung cancer cases, is the most common type of lung cancer. Non-small cell lung cancer starts in the cells that line the surface of the lung airways. These abnormal cells may quickly grow and uncontrollably reproduce and form tumors. Non-small cell lung cancer is generally classified into 5 stages, ranging from early to advanced. These stages help doctors determine how far and wide the cancer has spread so that they may choose the best treatment.
Can you tell me about the medicines being studied?
Fianlimab and cemiplimab are investigational medicines being studied as additions to chemotherapy for certain patients with non-small cell lung cancer. There are certain proteins on our immune cells that can stop our immune system from fighting cancer. PD-1 and LAG-3 are such proteins, acting like brakes on a car. Fianlimab attaches to LAG-3 on immune cells, helping the immune system attack cancer. Cemiplimab blocks PD-1, making it easier for the immune system to find and destroy cancer cells. By removing these brakes on the immune system, Fianlimab and cemiplimab help the body fight cancer better.
What is an investigational medicine?
An investigational medicine is a drug that is still being tested in certain cancer types or stages and is not yet approved for all diagnoses. Sometimes a drug can be approved for one disease but still be investigational for another. For example, Fianlimab is a new investigational medicine and has not yet been approved. Cemiplimab, with or without chemotherapy, is already approved for some forms of advanced non-small cell lung cancer, but it is investigational in this trial because it is not approved for patients with non-small cell lung cancer who can be treated with surgery.
Hi, I'm Dr. Frank Weinberg. I'm a thoracic oncologist at the University of Illinois, Chicago, UI Health. One of the reasons why I decided to participate in this study was really because of some of the data that we've seen with LAG-3 antibodies and melanoma. We know that lung cancer oftentimes mirrors a little bit the melanoma space. So I was excited to be able to bring a LAG-3 antibody into clinic. And then, cemiplimab too, which I've used in my metastatic patients, I think that has a real place potentially in early stage patients as well. And so I'm excited to be able to use this combination of treatment to hopefully improve the lives of patients that I see with early stage lung cancer.
What is the goal of this study?
The goal of the study is to determine if adding Fianlimab and cemiplimab to chemotherapy improves the outcomes more than adding only cemiplimab to chemotherapy in patients with non-small cell lung cancer who can be treated with surgery.
Can you tell me how this study is set up?
In this study, eligible participants will be randomly assigned to one of 3 groups. The first 2 groups will receive different doses of Fianlimab in combination with cemiplimab and chemotherapy before surgery, followed by Fianlimab and cemiplimab after surgery. The third group will receive cemiplimab and chemotherapy without Fianlimab before surgery, and then will receive cemiplimab alone after surgery. All medicines will be delivered directly through an IV every 3 weeks.
Who can take part in this study?
To join, you must have newly diagnosed stage 2 to stage 3B non-small cell lung cancer that can be treated with surgery. You must not have had treatment with anti-cancer therapies, including immunotherapy, chemotherapy, radiotherapy, or biological therapy within the last 3 years. You must also be 18 or older and meet some other health requirements.
Oftentimes I have patients that come in that are hesitant to enroll into clinical trials. I think the first thing to understand is what the hesitancy is coming from. Oftentimes it comes from a concern over the side effects of the medication. And oftentimes I can talk about the fact that some of these medications that we're using, we have them in clinic. We've been using these medications for some time. We just haven't used them in this specific setting. And so, to kind of reassure them that we're comfortable managing the side effects of the medications. One of the reasons why I'm passionate about clinical trials is because of the patient population that I take care of here in Chicago. They have, for historical reference, largely been forgotten from a lot of the large pharmacology and pharma-led clinical trials. And to be able to finally start bringing these larger trials that often lead to practice-changing standard of care changes, I think, is really important, and really important to include these patients on clinical trials.
We hope this video helped you learn more about the HARMONY Peri-Operative Lung Study. Check out the HARMONY Peri-Operative Lung Study page on myTRIAList, where you can find the study contact in case you have questions or want to find out if you qualify for the study. Visit the myTRIAList trial finder at myTRIAList.org to find the right study for you.